So here's the big question everyone keeps whispering before a major dental decision. Are clear choice dentists really the safest bet for dental implants? Or is that just powerful marketing? Dr. Esma, when people hear the name, they instantly think premium, fast, reliable. But is that the full story? Today we are pulling back the curtain. If you are considering implants and you are about to book a consultation, you might want to pause for just a few minutes. Because what you do not know could affect your comfort, your results, and your long-term oral health.
Rasim, that is exactly the point. Many patients walk in assuming bigger means better, but implants are not one size fits all. The real question is not just who places the implant, but how carefully your case is evaluated, how transparent the treatment plan is, and whether alternatives are even discussed. Before choosing clear choice dentists or any implant provider, there are a few critical things every patient must understand.
Let us paint a familiar picture, Dr. Esma. Someone loses a tooth, maybe two. They search online, see polished ads from clear choice dentists, glowing smiles, same-day implants. It feels efficient, almost effortless. They think, why not just go there and get it done quickly? No second opinions, no deeper questions. But what if their bone density is borderline? What if gum health has not been fully stabilized? Most people do not even realize these factors can completely change the outcome.
Exactly, Rasim. I often see patients who are drawn in by convenience and branding, but they were never told about preparatory treatments. Sometimes a simple bone graft or periodontal therapy makes all the difference. Clear choice dentists may offer streamlined solutions, but dentistry is highly personal. Your bite, your healing capacity, your medical history, they all matter. When decisions are rushed, expectations and biology do not always align.
And this is where it really matters, right, Dr. Esma? Because we are not talking about a haircut you can fix next month. We are talking about a titanium post fused into your jaw. If something is off, it is not just inconvenient, it can mean discomfort, extra procedures, even starting over. I have heard stories of patients who thought they were saving time, only to spend months correcting bite issues or gum inflammation afterward.
You are absolutely right, Rasim. I once treated a patient who chose a fast-track solution elsewhere. The implant itself was fine, but the bite alignment was slightly off. Over time, that tiny imbalance created pressure, headaches, and gum irritation. It took careful adjustment to restore comfort. That is why whether you choose clear choice dentists or another provider, precision and long-term planning are everything.
Dr. Esma, let us zoom out for a second. Dental implants have a very high success rate, often above 90% when planned properly. That sounds reassuring, but here is the twist. Success depends heavily on diagnosis, surgical technique, and aftercare. So when someone sees a strong brand like Clear Choice Dentists, they may assume that success is automatic. It is not automatic, is it?
Not at all, Rasim. I recently reviewed a case where a patient was considered a straightforward implant candidate. However, a detailed scan revealed subtle bone thinning in the posterior jaw dotting. Without addressing that first, the long-term stability could have been compromised. That extra step changed everything. Whether it is Clear Choice, dentist, or a private practice, thorough evaluation is what protects that impressive success rate.
All right, Dr. Esma, let us go a little deeper into the science. When people hear dental implant, they imagine a screw and a crown. Simple, but biologically, this is osseointegration, right? The bone actually bonding to titanium over time. That sounds almost futuristic. So if the timing, the pressure, or the placement angle is even slightly off, that bond can weaken. And that is not something you fix with a quick polish.
Exactly, Rasim. Osseointegration is a delicate biological process. Research shows stability depends on bone quality, surgical precision, and controlled healing. Even micro-movements during early healing can interfere with integration. That is why comprehensive planning, guided surgery techniques, and careful follow-up visits are critical. Whether someone chooses Clear Choice dentists or another clinic, understanding this scientific foundation helps them ask smarter questions.
All right, Dr. Esma, let us make this practical. If someone is considering Clear Choice dentists or any implant center, what should they actually do step by step? Because people love clarity. They want a roadmap, not just warnings.
Great question, Rasim. First, request a full diagnostic workup, including 3D imaging. Second, ask about bone quality and whether preparatory procedures are recommended. Third, discuss alternative options and long-term maintenance. Finally, review the follow-up schedule and who handles complications if they arise. This structured approach applies whether you choose Clear Choice dentists or a local specialist.
I love that. Simple, logical, empowering. When patients walk in prepared with the right questions, the entire experience changes. And that confidence, that is priceless. Okay, Dr. Esma, let us talk do and do not. Because when someone is excited about finally fixing their smile, logic can take a back seat. So what are the biggest red flags to watch for, whether it is Clear Choice dentists or any implant provider?
First, do not rush into same-day promises without understanding healing phases. Implants need biological stability. Second, do not skip discussing your full medical history. Conditions like diabetes or smoking habits influence outcomes. Third, never ignore follow-up care. On the positive side, do ask about success rates in cases similar to yours. Do request clarity about who performs each step. These details matter more than branding.
I like that balance. Not fear, but awareness. Because smart caution today prevents regret tomorrow.